You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker, owner and founder of Good Life Family Chiropractic here on the south side of Lincoln. And yes, I am proud to be a chiropractor. I'm proud to give you every day another message of health, hope, and wholeness. And let me tell you, my view of chiropractic and my experience with chiropractic is far different than what most of you perceive or have experienced. And I understand this because I actually went to chiropractic school thinking that I was going to become a specialist in back pain and neck pain and headaches, basically be a specialized physical therapist for people dealing with spinal issues. But what I figured out very, very shortly after ending chiropractic school, all because of a phone call from my mother, was that chiropractic has so much more to do with your healing and your function than it does to do even with the spine. You see, when I was a brand new baby, I was had a clean bill of health. I went home from the hospital at 2 days old with no signs, symptoms, sicknesses, diagnoses, nothing. But at 2 weeks old, the day of my first wellness check, I came home from that and I was breastfeeding and I quit breathing and I turned blue for the first time. So my mom did what any American mother would do. She freaked out. Fortunately, she was able to resuscitate me. She rushed me to the emergency room and they monitored me there all night and watched me quit breathing 14 times. 14 times. And they still couldn't give me a diagnosis. They couldn't give me a treatment. All they could do was keep me alive through emergency resuscitation procedures. And after that, they sent my mom to a specialist. I went to dozens of specialists, all with the same process. They did tests. They tried to find a diagnosis because they intended to give me a medication to treat the symptoms that they thought were in my lungs, but they couldn't figure it out. And so my mom, through this 6-month process, she's praying for me. She is asking friends and family to pray for me. She's asking for answers. She's asking for hope. And one of the first people to come to her is my mom's best friend. She'd been going to a chiropractor and she mentioned what was going on to her chiropractor. And he mentioned that he helped kids with breathing issues all the time. My mom had never been to a chiropractor, but my mom's best friend came back to her and said, Kelly, you got to take your son to see my chiropractor. He thinks he can help. And my mom put it off because she didn't understand what was going on. She had this perception that chiropractors were not real doctors and that you only go to them when you have a back or a neck problem. But my mom's best friend persisted all throughout the 6-month process. She asked my mom 7 different times to take me to her chiropractor. And finally, after getting told no 6 different times, she said yes. And I thank God she did, because she brought me into that chiropractor and all he was doing was playing with me. And he saw right away exactly what the problem was. I wouldn't turn my head to one side. It was cocked over to the other side. I had one eye open larger than the other and one pupil dilated larger than the other, all of which point to the top area of the neck, right around the bottom of the brainstem. It's where bundles of cranial nerves come out, the first 9 of which go back up into your head for the most part. The other number 10, cranial nerve number 10, it branches out and it goes down. If you're looking and you're following here on Facebook Live, we record these shows and we broadcast them on Facebook Live every morning at the same time as the radio show. You can see over to my left here that there's a black nerve that exits out and it goes to the lungs, and it goes to the heart, and it goes to the organs of digestion. And that nerve is called the vagus nerve. And the top bone in my neck was shifted so far out of position, wrapped around my brainstem, that anytime I tilted my head over to nurse or turned my head to feed, it would cut off the function running from my brain down through that nerve out to my lungs, and I would quit breathing immediately. He did one adjustment that day, and I have never had a breathing problem since. And so, yes, my perception of what chiropractic is far bigger than anybody you'll ever come in contact with out there, because I understand that the control of every organ, cell, and tissue in your body is determined by the expression of the intelligence that God gave us, that he sends down and housed inside of our brains and inside of our central nervous system, that expresses itself from the inside outward. And through that expression, we're actually able to bless the people around us through the purposes and plans that God created us for. And I think about all the stories, all the testimonials of patients I've had come through the office, people who couldn't sleep due to their pain, people who couldn't breathe properly due to similar issues, just like I had, people who had hearing issues that those cleared up after adjustments, people whose vision has gotten better, people who have been able to have a higher level of concentration, been able to get off of very dangerous medications, very dangerous psychotropic medications, all because someone said something. Someone still had hope, even when the doctors and the healthcare system gave my mom no hope. And if you're looking for hope this morning, it's time to pick up the phone and call my office. We're here on the south side of Lincoln at 56th and Pine Lake, right next to Campbell's Nursery. Our phone number is 531-289-7100. Again, that's 531-289-7100. And you can call or text that number with any questions that you have concerning your health, the health of a family member, and we will answer those on air or off air, however you prefer, to be able to help you and help them achieve the health wellness. And we're actually doing a free consultation, free virtual health consultation, whether that's over the phone or if you want to do a Zoom or Skype call, we can get on there with you. But the key thing with any of this is that we have to start to address the cause. Because you look at my story, they did what they do with everybody. Our healthcare system is failing. It's the most expensive healthcare system in the world and underperforms every other industrialized nations. We're 37th out of 37 industrialized countries. We're 72nd overall when it comes to health, all while having the best access to the best doctors, to the best hospitals, best facilities, best testing procedures, best treatment protocols. We come in last. And it comes because all we do is we address the symptom after the disease has already formed. We're dealing with forest fires. We're dealing with cardiovascular disease, which is a lifestyle disease of created inflammation that's been allowed to damage our cardiovascular system and allow for plaque buildup. And then the same inflammation actually, it hardens the plaque and it calcifies the plaque and it creates dead tissue underneath and necrosis and leads to heart attacks and it leads to strokes. And that's the problem. We die from that, or we die from cancer. Almost 2/3 of the time we die from two diseases that are both caused by lifestyle disorders, from interference to the healing process, from us being exposed to too many inflammatory sources with a doctor not willing to counsel you on the things that create inflammation. Things like pressure and damage to your nervous system. If your vagus nerve is not functioning at 100%, you have more inflammation in your body, period. If you have pressure or damage around your brainstem or your spinal cord, you have inflammation, period. If one joint in your body is out of alignment, a disease that we call arthritis creates inflammation in your body within 2 days if it's out of alignment and not moving properly. That's inflammation. It's killing you, period. And don't take my word for it. Look to the research. Look to the stories. Look to the testimonials of people that have gotten their lives transformed. Ken came in after meeting me at a home and garden show. Couldn't sleep because of the pain he was in every night. It was in his hip. He thought he was going to have hip replacement surgery. I took an x-ray of his spine. I looked and I saw there was no arthritis in his hip at all. Cutting out his hip and replacing it with a piece of metal was not going to fix his health problem. What he was dealing with was a lack of expression from his spine, from his brain, expressing itself out to that hip. And what had happened is the bottom vertebra in his back had dislodged, become unstable, and was actually disrupting the expression of function and health out to his hip. We began adjusting him. The first adjustment was the first night where he woke up and he wasn't in pain. And then within a few months, it went away completely, to the point where he doesn't think he needs it anymore. He healed. He feels way better, but he healed not because we treated his hip, not because we treated his pain. We didn't even just treat the source of his pain. What we did is we focused on removing the interference from his nervous system, removing the interference from his lifestyle, the things that create sickness and disease in him. We began to work on those, removing those interferences, allowing his body to heal and function the way that God designed it to. And if you're ready, like Ken was, to begin addressing cause, to begin to remove interference, and to align yourself with God's laws and principles of health and healing, and restore this living, loving, thinking clay that God created, that God designed out of two cells, duplicating and differentiating itself 36 trillion times, to be able to sit on the other side of a radio from one another right now and hear the hope that God has for us, for our health and for our future. For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you a hope and a future. Call our office right now, 531-289-7100. We're standing by to take your call. If you'd rather text, go ahead and text us at that same number. Again, 531-289-7100. You can also find us online. We're at goodlifefamilychiropractic.com. We're offering a free virtual consultation right now to begin walking you through some of the steps that we can initiate to get you healing. And if you'd like to come in for an exam, we offer that exam typically for $130. That's all inclusive. That includes the exam, that includes the x-rays. But if you're one of the first 5 callers today, we're going to give you a 50% discount off of that exam and off of any necessary imaging or x-rays. And that's usually a 3-day process. What we do to start is we sit down for an in-person conversation to see what your goals are, to see what's going on with your nervous system. We do an exam. I check your posture, your range of motion. I feel your spine. I feel the muscles and tissues around it. I look at the problem area and see what specifically is going on with that. And then we look to see how the nervous system is functioning with a digital nerve scan, surface electromyography, the accuracy of which, if we test it within and find it out of the normal range, in the severe or a depressed rate, it correlates at a 95 to 99% rate with problems developing along that nerve pathway within 5 years. It can be predictive or it can be reactive. But if you've got a problem developing, we need to test that nerve system. From there, we're able to determine how many x-rays we need of your spine to see what the cause is, what's creating that interference to that healing process. We'll take a look at those. That usually takes an overnight time spent looking over things, praying for your case. And then we bring you back. We go through the findings and we begin to develop a plan for correction. We'll typically do the first adjustment on your second visit to the office. That allows us to see exactly what's going on. That typical cost is $60 for that first adjustment. If your insurance plays a role, we'll figure it out. Bring your insurance card with you. We'll let you know if there's something that your insurance can do to help you out. If not, we've never turned away anybody for a lack of ability to pay. From there, I'll finalize my recommendations and we'll bring you and your spouse back for your most important visit to go through your recommendations, go through your findings, and develop that plan to get you on a path to correction, health, and wholeness. So pick up the phone, call now, 531-289-7100. I'm standing by and my team to take your call or answer your text. Tune in next time for another episode of Ask Dr. Jake.